Hi, this is Dr. Riley. Today I'm going to talk to you a little bit about the Mchat. The Mchat is a test that we give to kids like around 18 months, 2 years of age, and 29 months. This is to screen for the developmental problem known as autism. This has become really rampant in the United States. Luckily, at RBK, we're a little bit better than other places where we have 1 out of every 40 kids diagnosed with autism. But overall, when they look at boys, it can be 1 out of every 21 kids diagnosed with autism. So this is not good. So what we do is we follow a certain protocol, and what we do is we monitor all these kids when they have their MCHAT, and if they score above a 3 or above, they they actually follow our protocol. And one of the things that we do is we schedule for them a recheck MCHAT visit, right? And usually during these recheck MCHAT visits, we check to see how accurate the first MCHAT was. And if they start falling into that range where we worry about them, that they're starting to become autistic, then we do a kind of an approach that involves a lot of different things that we think are things that we can change and alter the direction of which the kid is developing. So when people ask me what causes autism, I tell them like, yeah, nobody really knows what causes autism, what single thing that causes autism, but we know many things that cause autism. And one of the things that causes autism is air quality. So just last year there was wildfires in California, and what they saw there was a huge increase in children being born with autism, especially to moms who are in their third trimester breathing in this smoke. So it's definitely a thing. And there is an app that you can download called airnow.gov that'll keep track of this kind of stuff so you can protect yourself and protect your child, especially if they're starting to show signs of autism. And then we talk about this and we talk about the indoor air quality, right? So certainly having a HEPA filter is something that's actually very helpful to try to help with, avoid some of these things that are causing us problems. Certainly food is one of these things that's important. One of the things that people are usually shocked when I talk to them about this kind of stuff is that 70% of the kids who are diagnosed with autism, they actually they have an antibody against the folate receptor alpha, and this is 100% linked to milk. So when we start to see kids who they're following this path of autism, one of the things we try to do is then avoid milk. That seems to be like a no-brainer, right? And we try to get them to drink lots of water, right? Because it seems like water is probably the best thing for these kids to drink. Now, in other autoimmune diseases, they've looked at this and they see that especially grains seem to be problematic for autoimmune diseases, right? So it makes sense that since we see such a high incidence of autoimmune disease and autism, that we should try to avoid grains as much as possible. So no wheat, no rice, no corn, no oats, right? So we talk about some of these dietary kind of things, but when we remove those things, we replace it with things that are more nutritionally dense. So that way the kids don't get themselves into trouble. And of course, the food that has the most vitamins out of every food is anything that's like an animal protein, right? So in this picture, we have a picture of some eggs with some ham and some beans and some broccoli, and certainly that would be very good. And that's like the kind of path that we try to follow for these kind of guys to see if they can actually eat diets that are more like this. The other thing we talk about is sleep, which usually how a kid learns to talk is they hear language during the day, and then when they're sleeping, all this knowledge kind of goes into their head. But they have to sleep enough, right? And some of these kids are not really sleeping enough. So we want them to sleep 11 hours when they're this age group, and we don't want them to eat anything right before they go to bed because your brain can't learn and digest at the same time. So we try to get them to do is try not to eat right before they go to bed, right? And that seems to be helpful. Certainly, just being a kid, going outside, exercising, being in the sun, all these things are very good for kids' brain development. So, and really, these guys have become a little bit too much inside kind of people. So, certainly, going outside, that's something that's very good for them. Now, if we see them and they do have a problem, then what we do is we refer them to early intervention. And the number in Suffolk County is 631-853-3100. And it's free. So why not make use of this, right? So one of the good things about early intervention, the early part is try to send them to get interventions as early as possible, because it seems like the earlier you start getting therapy, the better, right? So if you're getting this video, it's usually because we had actually looked at the screen for the MCHAT and we saw that we scored a 3 or higher. And one of the things we want you to do is to call the office to see if you can schedule the Recheck MChat visit. That would actually be very good, and we could start the ball rolling to see if we can kind of make some of these interventions. All right, thank you.